Hi everyone, this is Lynn here. This is episode 5, and I'm so delighted to share this information with you today. And I hope you're happy to receive this information too. I give you all a big warm hug, and I'm so glad you could join me on my channel with this information. I try and keep it simple and uncomplicated, and the topics are relevant in pharmacies, in fact, pharmacies probably all around the world. I put this information together with loving intentions and for educational purposes. I do have a famous saying that I absolutely love: prevention is better than cure, and I'm sure you've all heard of that. So, our topic today is a little on the sensitive side. And it's a very, very common concern for females and males, but mainly females. But the purpose of this video today is not to expose the drug that treats this condition, but to show you about some other alternative things that can assist with the modern day medicine, but also keep away this type of condition from happening to the body. So the question here is, as you can see, is this is a sensitive question. I think I have. Yes. Okay, we have thrush. So, as I said, it's extremely common in pharmacy. And it's very nasty if it goes untreated. And even some children, older people, you can get it at any age. So, just quickly, as I said, I don't want to really talk about the antifungal creams, but that's what you would go to a pharmacy for and get an antifungal cream, a tablet or a capsule, and you would take this to clear up the yeast infection. So, the common symptoms are the white coating on the tongue, redness and soreness as well, loss of taste, pain when eating, and difficulty speaking. They are just a few of the symptoms when you have thrush. If it's oral thrush, it's treated in a little bit different way than to the vaginal thrush. So, what's next after this? And if I get a chance to talk to people in the pharmacy, they will ask me this question: how can I stop this from happening? What happens to me? Why do I keep getting this so frequently? And it also is a very common question, too. So, firstly, I would advise we have to look at the diet. Our diet triggers all the malfunctioning things in the body. So, let's quickly go through the list of things that can trigger thrush in the body. And if you can avoid these, well, hopefully it won't happen at all. So the usual triggers are a theme in all of my videos. As you'll see: sugar, refined food, ultra-processed foods, junk foods, wheat, yeast, soft drinks, anything high in sugar, fruit juices, fruit, chocolate, biscuits and cake. Antibiotic usage and medications, wearing clothing too tight. So we always advise to wear cotton next to the skin and not have things too tight to the body. Avoid highly perfumed sprays in the delicate areas and harsh soaps. They strip all the natural body oils and can cause this to happen as well. So poor hygiene, so always wash your hands, keep your body clean. Weakened immunity, autoimmune diseases, smoking and alcohol. So these things are common triggers, and maybe people just don't realize that doing all of these things, or even just one or two of these things, can trigger a response. So as I mentioned, I wanted to introduce a product that is just amazing, and it can accompany the fungal antifungal creams, or you can use it as a preventative. And that amazing product is called Serrapeptase. So serrapeptase is an enzyme, and it was found back in the 1960s by the Japanese scientists who were doing some testing on their silkworms. And what they found, that the enzyme is derived from a bacteria in the digestive tract of the silkworm. I know that sounds pretty gross, but I think we just have to think about the bigger picture here. The enzyme makes it possible for the silkworm to eat through and disintegrate its cocoon, which then it develops into a moth. So scientists found that this remarkable enzyme, once it had been tested and they did what they needed to do with their testing, that it actually improved a lot of conditions in the body. And they were the treatment of diabetes and arthroscoliosis and inflammatory bowel disease were what was discovered at that time. But now there are a lot more things coming to light what this enzyme can do. And this is what I want to show you today. So, how does serrapeptase, this little enzyme, work in the body? So, in our bodies, we have biofilms. We have a protein biofilm and a bacteria biofilm. And the serrapeptase is like, I liken it to, if you remember the old Pac-Man game where the little dude goes along and munches up all the things and his opposition. Well, I see serrapeptase as that little Pac-Man going along and munching up and gobbling up and dissolving the biofilms in the body. So when we have so many of these biofilms and yeast in the body, it actually creates the thrush and the bacterial infections, which I think is pretty interesting. So here's a list of things that the serrapeptase can also do in the body. As I mentioned, it dissolves yeast and the biofilms, whether they're protein or yeast. And in the protein range, that means breaking down damaged tissue, clearing debris like fibroids, cysts, and scar tissue. We've already mentioned the benefits of arthroscoliosis, which builds a plaque in our arteries, and the serrapeptase goes along and gobbles that up and gets rid of it. It's also beneficial with cleaning mucus and liquefying mucus. It actually brings the deep tissue to the surface and helps clear the sinuses. So this could actually help with chronic respiratory diseases, so CRD and COPD. It has amazing anti-inflammatory properties, and it also has this enzyme you can use to treat acute pain by blocking the pain-inducing chemicals that the body produces ourselves to create pain. So there is a little bit of a caution on here, and anyone that's taking aspirin or warfarin would probably not use serrapeptase. There have been noted rare side effects with it, but they are rare, and of course they need to be noted. So skin reactions and muscle and joint pain, sorry. You can lose your appetite and stomach pain, a cough, and you can have disturbances with blood clotting. Of course, we always say if you're not sure about starting any new vitamin or supplement of any description, always speak to your doctor about the medication you're on and whether they advise it or not. So I wanted to talk about two other things if you have thrush, besides what serrapeptase can do, and some very interesting things that I've tried myself and I'm still using to this day. And my very favorite product is oregano oil. And if it's 80% carvacrol, which is the active ingredient in oregano oil, it has 4 or 5 amazing properties. So if you take it on a regular basis, it is antibacterial, anti-inflammatory, antimicrobial, antiparasitic. It has an analgesic property, and it is very high in antioxidant properties. It is truly an amazing gift from nature. If you have thrush and you are feeling very uncomfortable, a warm bath with a few drops of tea tree oil in it is very soothing. And I have spoken about a probiotic called SB, so Saccharomyces boulardii is another one that you could take with thrush. Cooking with more turmeric, garlic, and lemon, and taking apple cider vinegar in warm water is another one. And another one is your lemon juice squeezed in warm water when you wake up in the morning on an empty tummy. Now, the oregano oil and the lemon juice and apple cider vinegar are all very alkalining, so it's something that you can do every day and not have, you can't overdo it. It's very beneficial for the body. So this slide, I always like to give my review, my perspective, and this time my own personal testimony. I'm just going to put my glasses on and I've got my notes here. So as I mentioned, my own personal testimony. I first recognized serrapeptase when I was following Dr. McCullough. He brought my awareness to how incredible this enzyme was. And as you can see, there are a lot of things it can do in the body. I didn't have thrush at the time, but I just felt that my body felt heavy, and I thought I would give serrapeptase a go. So I used it once a day on an empty stomach. First thing in the morning, I would take it, and I did that for 6 weeks. And I found that it really, really made my body feel so much better, so much lighter. Um, I just felt really good on it. And I shared it with my daughter, and she has dreadful sinus problems, and she reported back to me saying that her sinus issues had all cleared up and her singing voice was almost back to what it was when she was a teenager. That's just one small aspect of that. So it is something really worth considering and even trying, just to clear up the biofilms in the body that we've been accumulating for years upon years, the cysts, as I mentioned, and the proteins that are all in our bowel area. You'll just start feeling better and your bowel operates better. I just can't say enough about it. I would give it a go. Um, so, as I mentioned, you would use it in conjunction with your antifungals. It's not, unfortunately, a line, well, it's not in our pharmacy. Serrapeptase is a little bit tricky to get here in Australia. I don't know about other countries, but I'm going to put my link for Iherb in the description box. I don't normally sell anything on this channel. I don't make any money from this information. But I really feel that if you want to look at Iherb, then you can find a suitable product there. I would probably do 40,000 IUs. I wouldn't go any more than that because it does have that blood thinning effect. And if you are on other vitamins like turmeric and fish oil and K2, they all have a blood thinning effect as well, but it won't affect you. Well, it shouldn't affect you with the serrapeptase. Um, the other thing I wanted to say, will thrush clear up on its own? Does thrush have or should the body clear up thrush for you without having to go to any antifungals? Well, all I'll say to that, because that's something that is also asked in pharmacy too. If you go back to the slide where the triggers are and you avoid all those triggers and cut out the foods and refined foods, I would say yes. And if you have a very good responding autoimmune system, I would say yes. But if you feel that, it's really taken hold, well, probably the antifungals would be the way to go at that time. Okay, and in my next video, it'll probably be a two-part series. It's a pretty big topic because I've been leading into all of this leading into diet and lifestyle and the alkaline diet. I want to talk about how we can get our bodies really back into balance. You can lose weight by just changing your diet to alkaline foods. So I look forward to sharing that with you. And as I said, I think it'll be in two parts. I'd like to thank you very much for being here. I'm so grateful, very grateful that you watched my video. And could you please subscribe if you like the information, share it, and share it with your friends and family because these topics are very important. And there's not a lot out there of people talking about serrapeptase. I think it's very, very important enzyme to at least give it a try once. So I'm very grateful, and I'll see you on episode 6. Thank you so much. Blessings to you all.